And joining us now, the Gairdner Award winner, Dr. Nubia Munoz, who comes to us as the Emeritus Professor at the National Cancer Institute in Bogota, Colombia, and we're very grateful you could spare some time for us tonight.
Thank you.
I want to talk about your recognition, first of all. You won this award for proving that cervical cancer is caused by the human papillomavirus. And I wonder, first of all, how significant is it to show that a virus can cause cancer?
Oh, has very great implications, because if we know the cause of the cancer, that means that we can attack that cause. And this is what's happening now, because after we demonstrated that was without any doubt that this virus was not only the main cause, but also a necessary cause. That means that if there is no infection, there is no cancer. Therefore, this was a great stimulus to the pharmaceutical companies to develop a vaccine to prevent infection.
And we'll talk more about that vaccine in a second, which you were very integrally involved in. How is, though, I want to understand more about how research and treatment will be changed as a result of this link now between a virus and cancer. How's it changing research?
Well, research is still ongoing on because there are certain factors that are not very well known still. For example, we know that this infection that is sexually transmitted is one of the most common sexually transmitted infections. Everyone who has a normal sexual life have a risk of 80% of acquiring the infection.
And the more partners you have, the greater your risk.
The more partners, the greater the risk. But only on a small proportion of the people with the infection go to develop precancer and then cancer. And therefore, should be other factors that we call cofactors that will influence the progression from chronic infection towards cancer. And this is in the focus of much research now. We had unveiled some of these cofactors in our studies, and these are, for example, women that have many pregnancies, 6 or more pregnancies. They have a higher risk of progressing from infection to cancer. Women who smoke have twice as much risk of progressing. Women who use oral contraceptives for more than 10 years also have 4 times higher risk of progressing to the cancer. But in addition to these that are external cofactors, there are other factors linked to the host, to the genetic susceptibility, and these are the ones that are still to be identified.
Okay, so you're learning more and more. What do you still not know that you really want to know about the HPV?
Well, this specifically this, why some infections are eliminated quickly within 1 year or 2 by the natural immunity, and why others become chronic and stay there, and these are the ones that are going to cancer. We know very little what makes this difference in the type of infection.
This became a very big issue in this province of Ontario a couple of years ago because the government made an announcement to have a widespread vaccination program. And I just want to bring up some information here to bring everybody up to date on where we're at in that. Year 1 was 2007-08. 49% of grade 8 female students in Ontario have completed all 3 doses of the HPV vaccination. Obviously, you need 3 doses. That's almost 40,000 girls in total. The program, however, is only voluntary, not mandatory. The second year of the HPV vaccination program is still underway. All that information courtesy the Ministry of Health. Here in this province, the vaccine is paid for and actively promoted by the provincial government. So I wonder how our numbers compare to other places in the world.
Well, within this Gairdner celebration, I had the opportunity of visiting in Montreal and Quebec last week. And I had the opportunity of discussing with the people that are also running the vaccination program there. and it's doing much better than here.
They have a higher buy-in, do they?
Yeah,
What?
higher coverage. So they have different cohort of girls being vaccinated, not only the 8th grade, but also younger girls and older girls. Here in Toronto, I understand in Ontario, only one cohort, the 8th grade girls. And I think that also plays a role the education, how much information not only the care providers, but the public in general have about this infection and about the benefits of vaccine.
Well, and I gather you can get it as early as age 9, and the idea is to get it before you start having sexual relations.
Exactly.
Once you start having sex, is it too late?
Not too late, but the impact will be a bit less than if you get it before you start sex. Because the trials that had been conducted around the world with the Gardasil or quadrivalent vaccine involving over close to 25,000 women had showed that some of these women were not infected and about 1/3 were already infected. But a small proportion will be infected with 2 or more types. And since the vaccine has 4 types, if you had been infected with one type, you still can be protected for the other 3 types.
I see.
So, but the impact will be greater if you are naive totally to the virus.
What is the, okay, so we understand the situation here in Ontario. You've said there's more uptake in Quebec. How about in developing countries around the world? How much uptake has there been there?
Well, 0.
0?
0
That
because the programs have not started. The problem with this vaccine is that it's a fantastic vaccine, very efficacious, very safe, but expensive for developing countries. And this is really a serious problem because 83% of cervical cancer occur in developing countries.
And it's an awful cancer, isn't it? It's terrible.
Especially because it affects relatively young women in the 40s, 50s, and these are women that had many children, and they are not treated, they die, and not only the women is out, but also it's a tragedy for the whole family. So there are families that are devastated with this disease.
Now you say it's safe, and I want to read something from the Gardasil vaccination. I want to read something that was reported a couple of months ago in the Globe and Mail, which is our national newspaper here in Canada. Andre Picard is the health writer there, and he says, after more than 23 million doses of HPV vaccine administered to young women in the United States, a mere 12,424 adverse reactions have been reported, according to a new study from the Journal of the American Medical Association. There were 32 deaths reported among those who received the vaccine. The rates of severe illness and death are similar among those who have been vaccinated and those who have not, meaning the HPV vaccine was not necessarily fully or even partly responsible for those health problems. So the vaccine seems to be relatively safe, according to the reporting. If that's the case, why are so many people refusing to get it?
Because they had not been educated, really, in relation to what represents this disease, this infection, and they don't know much about also this safe profile of the vaccine. There are many rumors, bad publicity with practically all vaccines. So that's why it's very important education, not only of the general public, but also of the medical care providers.
Do you think every parent of a 10, 11, 12-year-old girl should have their child vaccinated?
I will recommend that.
Everyone?
I will recommend that, yeah.
It's $130 a dose, and as we said, the government is picking up the cost of that. I guess the taxpayers are, the public purse is. That is a lot of money for a dose, and there are limited public health dollars to be spent. And we are, as you know, in the middle of a huge outpouring of concern right now for the swine flu virus, H1N1.
Yeah.
So what's the best way to spend our public health dollars? HPV, the flu, something else?
Well, I think that you need a bunch of modelers to run these studies and tell you which is the most cost beneficial intervention right now. I think that I cannot tell you in 1 second, but what I can tell you is that this is an important public health problem here also, despite that Canada is one of the countries in which the incidence of this cancer has been decreasing over the last 40 years because of the screening programs. But I understand that there is a sort of leveling off of this decrease in incidence, and the coverage with the screening program is not ideal, is around 70% at the most. And there is certain proportion of women who are detected with these precancerous lesions and they are lost to treatment. They don't come back for be treated. So there are problems of this type that has to be compared. So what is the most efficient way of putting your money? Improving the screening program or having a very good vaccination program? What we know is that to have a good impact with the vaccination, the most important is to have a good coverage.
I want to spend our last few minutes, if you don't mind, talking about you.
Okay.
How important is it, in your view, for researchers to receive awards like the Gairdner Award, the money that goes with it, the recognition? Is that a big deal?
Fantastic. It's like a dream. You know, I never thought when I started medical studies and my research career that I will be here one day receiving this very prestigious award. And another important thing is that in general, these very prestigious awards in biomedical science are given to recognize achievements in basic research, research that is done in the laboratory. That is very important. But very few awards recognize research that is done in human populations at the epidemiological level, like I had been doing during the last 30 years. So I believe it's the first time that this award is created to recognize this type of research in global health, and especially research that is have a great impact in developing countries.
I'm told that you originally wanted to be a doctor, but then you had second thoughts and decided to go into research instead. How come?
Yeah, well, I did medical studies, I did medicine, and I like very much treating patients, but I got too depressed when some of the patients died or didn't get well. So I decided I better go into something that I can benefit larger groups than one given patient.
And why did you want to focus on this human papillomavirus in particular?
I had focused in general in cancers linked to infectious agents, because one of the reasons is, of course, the perspectives of having a better prevention through vaccine, and also because these cancers are very important for developing countries, especially.
I want to ask you about what it must have been like to be a woman in your field in the 1960s in Bogota, Colombia. How was that?
Well, it was not that easy, you know, because still, despite that there has been a lot of progress for women, still I think there is a difference at all levels. If you are a woman, you had less opportunities, I think. At that time in my medical school, we were 4 girls out of 35 boys. Now I think the situation is changing, and sometimes the behavior of the boys is a bit difficult with the girls studying medicine.
Well, I wonder about that because you'll forgive the stereotype, but you've heard it before. The Latin American men are, pretty macho.
Oh, yeah.
And they may not have appreciated seeing women taking up spaces that they thought maybe men should be taking up. Did you run into that problem?
Yes, exactly. From the beginning of my medical studies, I was raised in a poor family in Colombia, and in the university, in the School of Medicine, if you are number one, you don't pay tuition. If you are number two, you pay half. And the first year was the richest boy who was number one, and I was number two. And since then I said, well, to help my family, I had to be number one. So during the rest of the career, I was number one. But this boy never believed it. He said, it's not possible. He went back asking my professors, how come? How are her notes?
That's nasty, isn't it? Yeah. That's nasty. Whatever happened to him, do you know?
I think he's someplace in the U.S. as a psychiatrist.
But I bet he never won a Gairdner Award.
No.
No. Dr. Munoz, it's very good of you to join us here at TVO tonight. Congratulations on winning the Gairdner Award, and a safe trip home once you leave here today.
Thank you very much.
Thank you.
Thank you.